Talking about sex with your spouse is one of the most common struggles I see, even for couples who come to therapy specifically for sexual issues. It makes sense. Sex is personal, vulnerable, and emotionally loaded. Many people fear judgment, conflict, or hurting their partner's feelings. Others feel insecure about their sexual performance or simply don't have the language to talk about sex comfortably. And for many, past experiences like betrayal, trauma, shame, or rigid religious messages make the topic feel almost untouchable. But the truth is, talking about sex creates connection. When you can communicate openly, your sex life becomes more satisfying because you're not guessing what your spouse wants. Emotional intimacy increases, misunderstandings decrease, and both partners feel safer and more confident. So, how do you actually start the conversation? First, choose the right time, not during a fight and not during intimacy. Approach your spouse calmly and say something like, I'd love for us to set aside some time to talk about our sex life. I'm not upset. I just want us to feel connected. Try removing distractions, sitting where you can make eye contact and acknowledge that this feels vulnerable. Then share your intention, whether it's understanding each other better, feeling closer, or improving satisfaction. As you talk, stay curious. Ask questions instead of blaming. Use I statements instead of things like, you never. Share what's going well so your spouse doesn't feel criticized. And when you make requests, offer invitations. I think it would be fun if we tried, instead of demands. Helpful things to discuss include how often you each prefer sex, differences in desire, best times or energy levels, how you like to initiate, what helps with arousal, aftercare preferences, and boundaries. What's always okay, what needs a check-in, and what isn't okay. And remember, this isn't a one-time conversation. Check in again as things evolve. If talking about sex consistently leads to tension or shutdown, that's a sign that getting help from a trained sex therapist could be really supportive. And if you need guidance, I'm here to help.